door, provide privacy, wash my hands. I have reviewed my policy and procedures and also saw that the doctor had ordered me to irrigate my patient's catheter. So I'm going to introduce myself. Hi, I'm Emily. I'm a Lake Superior College nursing student. Could you state your name and date of birth for me, please? Okay, looks good. I'm just in here to have your catheter irrigated. We're going to do that right now. The doctor had ordered me to do that with some blood clots in your catheter, just to clear them out. So at this time, I'm going to put the bed into a good working position for me. I'm going to take a look at his catheter bag. If it had any urine in it, I'd want to empty it at this time, and I'd want to document that in my charting. He does not have any urine, so we're just going to leave that for now. At this time, I'm going to drape my patient, making sure he has some privacy and I have some working space. Okay, I'm going to wash my hands here with hand sanitizer and put on my clean gloves. Okay, and then at this time I'm going to open my package.
Okay, so
I'm going to grab this and just set it to the side. And I'm going to grab my drape, shiny side down. I'm going to lay this underneath my patient. Okay, and at this time I'm going to put my tray here. Okay, now at this time I'm going to get my alcohol pads ready. Then I'm going to get to this ready here. So I'm going to grab my saline. If it has been opened, I'd want to make sure the expiration date was within 24 hours in order for me to use it. I would want to lip it in the garbage. Then I'm going to take the cap off, setting that to the side. Pour my solution. Set this to the side because I'm all finished with that. Okay, then I'm going to take my alcohol pad. I'm going to clean here where it's connected. Okay. I'm going to unconnect it here. I'm going to place that right there while I grab my cap. I'm going to alcohol pad on here again. 10 to 15 seconds, making sure it's clean. Place my cap on here. I'm going to make sure that this is on the bed and it's not falling on the floor. Okay, and then I'm going to get another alcohol pad and clean here. Okay, and that's clean. So then I'm going to actually, I'm just going to hold it now that I had just cleaned it. Okay, I'm going to set it there because I need to come over here and get my solution. Okay, and about 30 mils here. Okay, and just take some deep breaths for me, and if you have any bladder spasms at this time, I'd want you to let me know. Trying to push that in there slowly. And let it leak into the basin. And I'm going to repeat this one more time. One more time, I'd want him to let me know again if you are experiencing any spasms. Good. Okay, and now I'm all done with this. I'm going to set this to the side. Okay, and at this time, I'm going to remove my cap here. I'm going to alcohol swab again. Okay. And I'm going to hold this, and I'm going to grab one more alcohol pad. And I'm going to, making sure these aren't touched, I'm going to clean here again. 10 to 15 seconds. And I'm going to be placing this back in here. Okay, and then I would strap that onto my patient's leg, making sure I'm not pulling on the catheter at all. And I'm going to remove this, and now I'd want to make sure I document this in my chart. I'd want to document how much I irrigated into him, which was 60 mils, and then subtract that from the amount of output. So I want to make sure that's in the chart as soon as I'm done. Then I want to remove my Chuck's pad from underneath him and dispose of that in the garbage. Take my gloves off. I'd want to provide privacy. Cover him back up. Bed is in low position. I'm going to put your call light in reach, and I'm going to go document that in the chart. And if there's anything I can do for you, just ring your call light.